Welcome to my topic today by Dr. Gero Sylvester. Today I want to take you through adverse childhood experiences. Adverse childhood experiences are potentially traumatic events that occur in childhood between 0 to 17 years. For example, it can occur in children experiencing violence, abuse, or neglect, especially for those street children, for those who can also be found in polygamous families, for those families that are in children with out of wedlock children, or for polygamous families. That are kind of few examples. They can also occur by these children witnessing violence in the home or community, having a family member attempt to die by suicide, or a family member dying by suicide. Also included are aspects of children's environment that can undermine their sense of safety, stability, and bonding, such as growing up in household with substance use problem, mental health problem, instability due to parental separation, or household members being in jail or prison. Please note that the examples above that I've just said are not a complete list of adverse childhood experiences. Many other traumatic experiences could impact health and well-being, that is, mental well-being of the child. Acute childhood experiences are linked to chronic problems, mental illness, substance use problem in adolescence and adulthood. Acute childhood experience can also negatively impact education, job opportunities, and earning potential. However, acute childhood experience can be prevented. I want to tell you how big is the problem. Acute childhood experiences are common. About 61% of adults surveyed across 25 states reported that have experienced at least one type of acute childhood experiences before the age of 18, and nearly 1 to 6 reported they have experienced 4 or more types of acute childhood experiences. Preventing acute childhood experiences could potentially reduce many health conditions. For example, by preventing acute childhood experiences, up to 1.9 million heart disease cases and 21 million depression cases could be potentially avoided. Some children are at greater risk than others. Women and several racial ethnic minority groups were at a greater risk for experiencing 4 or more types of acute childhood experiences. Acute childhood experiences are costly. The economic and social cost to family, communities, and social total hundreds of billion dollars each year. A 10% reduction in acute childhood experience in North America could equate to an annual savings of 56 billion. Though Kenya, here in Africa, there is not much research that has been done, but it equally affects us. Now to take it to the consequences. What are its consequences? Acute childhood experience can have lasting negative effects on health, well-being, as well as life opportunities such as education and job potential. These experiences can increase the risk of injury, sexually transmitted infections, maternal and child health problems, including teen pregnancy complication, and fetal death, involvement in sex trafficking, and a wide range of chronic diseases and leading causes of death such as cancer, diabetes, hypertension, and suicide. Acute childhood experiences and associated social determinants of health, such as living in under-resourced or racially segregated neighborhoods, frequently moving and experiencing food insecurity, can cause toxic stress, extended or prolonged stress. Toxic stress from acute childhood experience can negatively affect children's brain development, immune system, and stress response system. These changes can affect children's attention, decision making, and learning. Children growing up with toxic stress may have difficult forming health and stable relationship. They may also have unstable work histories as adults and struggle with finances, jobs, depression throughout their life. The effect can also be passed on to their own children. Some children may face further exposure to toxic stress from historical and ongoing traumas due to systemic racism, or impact of poverty resulting from limited education and economic opportunity. So how can we present acute childhood experiences? Acute childhood experience can be preventable. To prevent acute childhood experiences, we must understand and address the factors that put people at risk for at risk for or protect them from violence. Creating sustainable, safe, stable, nurturing relationship and environment for all children and families can prevent acute childhood experiences and help all children reach their full potential. To help countries and communities use best available evidence, we have 6 strategies, and we have strategy number 1. We have to strengthen economic support to families, strengthening household financial security, family-friendly work policies, promote social norms that protect against violence and adversity. That's number 2. That is public education campaign, legislative approaches to reduce corporal punishment, bystand approaches. Men and boys are areas of prevention. Ensure strong start for children, early childhood home visiting, high quality child care, preschool enriched with family engagement. Then you have teach skills, social emotional learning, safe dating and healthy relationship skills, that is among the teenagers and all the adolescents. Through that, they'll have to give birth at the right time so that we avoid some things. Connect youth to caring adults and activities. Enhance primary care, victim-centered treatment or lessen the harm of acute childhood experiences, treatment to prevent problem behavior and future involvement in violence, family-centered treatment for substance use and disorders. Raising awareness of acute childhood experience can help change how people think about the causes of acute childhood experience and could help prevent them. Shift the focus from individual responsibility to community solutions. Reduce stigma around seeking help with parenting challenges or substance misuse, depression, or suicidal thoughts. Promote safe, stable, nurturing relationship and environment where children live, learn, and play. Kindly, let's help all children reach their full potential and create neighborhoods, communities, and world where every child thrives.